Microbiology is something which is of course, all the four subjects go hand in hand together, but I'm starting with the first subject of the second prof, which is microbiology. In microbiology, we are talking the bacteria, the fungi, the viruses. What you've studied, just an opening snapshot in your 11th and 12th. You are studying the entire classes of these bacteria, entire classes of these viruses, entire classes of these fungi,
Mm.
and what kind of diseases they are causing. What are their life cycles? How these bacteria, where the world is witness to the COVID pandemic rather, which affected the entire world, and it was a global emergency. Now, it is here that, the microbiology concepts are coming
Mm.
into play. Every,
So in
disease,
fact, you go to any
infectious
doctor, I
disease.
can say so the practical implication of it. सबसे पहले जो आपके टेस्ट लिखे जाते हैं, so I think they both comprises of biochemistry and microbiology, and this somewhere expands into become MD pathology or something like that. So I think these are the first levels of
Yes.
diagnostics. The application part of it starts here.
And then when you're coming to pathology, pathology is, of course, where we are studying this live organs,
Mhm.
and the pathological basis of disease. That is what, when you study internal medicine, surgery, and the various disciplines, the pathology is the foundational aspect of it all. Pathology is all what is abnormal. Path
Okay.
plus path plus logy. Path is, diseased. So the
Mhm.
science of disease, the causative factors, the etiopathogenesis. We say etiopathogenesis takes into account etio as the cause, path as the structural. What is there's inflammation, there is infection, there is pathology talks about, in a sense, all that. The basis of disease is pathology. So in that we will be seeing a lot of organ specimens, understanding their nature. You've already studied anatomy in first prof, where you've seen the normal liver. Now you'll be seeing a diseased liver, how it looks like. And then your thinking buds should go, wild, as in, now what all diseases, microbiology, then you will have to think and, understand how these diseases are caused. So before you start treating diseases, you have to understand what is normal. In the first 1 year, you're studying what is a normal human body through
Mhm.
anatomy, physiology, and biochemistry. In the second prof, you're studying all the basis of the abnormal. What is causing the abnormality or an abnormal situation, which we call as disease or disease? So microbiology will tell you the infectious causative entire universe of that. Pathology is telling you the structural basis of the human body. Say, for example, if there is a cholelithiasis, so how a cholelithiasis, is that the gallbladder has a stone. So how a stone gallbladder looks like, that picture in mind, when you have seen those specimens, it gives you a lot of understanding about how the disease progression will happen, what kind of treatments should follow through. So it's all integrated. So this is pathology. Of course, all the blood tests and the entire spectrum of testing and diagnostics in the blood and fluid specimens goes through an MD pathologist whose signatures are going on the lab reports. So that essence, the studies are going in the microbiology biology lab and the pathology lab.